So I'm the guy who has nearly 60 people working across the Scripps system, supporting computers, laptops, tablets, and phones, making sure that doctors and nurses can stay connected and take care of our patients.
Hey Christina, how are you today?
Since COVID, we've looked at new technologies that helps better the experience between doctors, nurses, and the patients, as well as allowing families to communicate with patients in our system. I think it's just really important for everybody to understand that we're here to support Scripps. We have staff in the clinics and in the hospitals, and we're here to take care of those who take care of others. We're all in this together. We deal with stress through this pandemic just like everybody else, but it's our job to be here for the doctors, for the nurses, and ultimately our patients, putting technologies and tools in their hands to make the best of what we can through this pandemic. It's rewarding at the end of the day on my drive home to know that I did what I could to contribute to make things better. There's a few new technologies that we've implemented in our hospitals. One is issuing an iPad to patients, allowing them to do video calls to their families, whether they're in San Diego or really around the world. As you know, patients are in isolation. They don't have the opportunity to take visitors, and so this really helps them make that connection to their families. In fact, we had a request to implement this solution when we had a patient who was nearing the end of life and desperately wanted to see their family and say goodbye one last time. So within a day, we turned the solution around and had that in their hands so that conversation could take place. Another solution that we've implemented is attaching cameras to IV poles. This allows patients who are either in the emergency department, in the ICU, or in the COVID wards to maintain communication with the doctors and nurses. If the doctors and nurses don't have a physical reason to go into the room or use protective gear, they can simply hit a button and have that conversation with the patient while saving on supplies. When we were trying to obtain some iPads, we had donations come in from across the community. Those iPads were some of the first that ended up in patients' hands, and it's just a wonderful feeling to know that we can depend on our community for support as we continue to try to take care of our patients. So after deploying these iPads, I followed up with some of the nursing leaders to see how well they were working for them. And this is one of the emails I received back. It worked. The wife and daughter are both finally able to see him. First time since March 23rd, 2.5 weeks. We are all in tears here, so emotional and so worth all of your efforts. Please tell everyone involved how valuable this has been. And that's why I work for Scripps. I get to make a difference in people's lives and better the patient experience.